Good afternoon, everyone. It is now 1 o'clock, so we will go ahead and begin. I still see people that are filtering in, and I know this is right after lunch, but we'll go ahead and get started. Just a couple of housekeeping items. If you have any questions at any time, please select the raise the hand button. Also, please feel free to drop any questions in the chat or in the Q&A section as well. And let us know at any time if you are unable to hear us or if there's something maybe going on tech-wise, so that we may pause and see if there's a way that we can assist and we can fix that for you to make sure that you are absorbing all the great content that we have today from our great presenters. Welcome to the National RTAP Mobility Management training webinar series. Today's title is How to Build Effective Partnerships Using Mobility Management with CCAM. Today's topic will be a great review for DOTs, transit agency staff, grant administrators, mobility managers, or navigators, making sure that you have a great overview of how to build partnerships, how to sustain partnerships through CCAM on a local level. Here at National RTAP, we do just kind of want to let you know that we have a great team of experts. We are here to assist you with all your rural transit and your community needs. And this is our listing of all of our team members. Please feel free to contact us at any time at info@nationalrtap.org. Today's presenters will be I, Anjali Dixon. I am the Rural Transit Project Manager, and I am based in the middle United States in Missouri. We have Christy Winchester, who's a mobility manager at Central Rural Region of Oklahoma. And we have Raven Alexander, who is the president of Association of Travel Instruction, and she is based in Kansas. Today, we'll just have a brief overview of CCAM, some community examples per their presentations from Kansas and Oklahoma, and then we will have a little bit of time for questions and discussion. So I wanted to start off just with a couple of things on what are the foundations of effective partnerships here. Oh, excuse me, if you will, let's pause just 2 seconds here. It looks like something got a little shuffled around. Okay, if one of the panelists can give us a thumbs up here. Okay, thank you, Christy. I apologize for the technical difficulty. Looks like some things got a little shuffled around. So we're going to start with a brief overview of CCAM, which is the Coordinating Council on Access and Mobility. During that time, since 2004, it has brought together 11 federal agencies to focus on improving transportation. 9 of those agencies actually are able to fund human services transportation. Mobility managers serve as essential connectors for transportation in all communities across the nation. And they are the boots on the ground that are able to coordinate events such as town halls, survey the landscape. They serve as brokers, and they help users or riders or clients, depending on what organization you are hosted in, navigate the complex transit systems and the various modes that our communities host. In 2023 through 2026, a strategic plan has continued to highlight all of those partnerships, and those are the basis and the foundations for the successes that we are having through the partnerships at a local level, at a state level, as an overall regional level, and at a federal level. So to understand the CCAM ecosystem, we have put this together. And as I stated before, there are federal partners, and these include partners such as DOT, which is Department of Transportation, Health and Human Services, also HUD regarding housing, and they coordinate transportation policies. There are 9, as I stated before, that can fund human services transportation. There are several funding programs, about 73 plus programs that are eligible that can fund transportation nationwide. A lot of your key stakeholders not only include your transportation providers, and so we want you all to continue to think outside the box and look at partnering with social service agencies. Also, we know the number one partner a lot of times is healthcare organizations as we continue to try to get people to doctor's appointments and to health clinics and specialty appointments, which is usually kind of the number one reason why people need rides. And then also looking at how we implement this locally on a state level and also down into the central core to our communities, especially in our rural communities where there's a very, very high need. Now, for the foundations of effective partnerships, you want to start with that trust and how you build those collaborations, trusting each other. Communication is key and it needs to be consistent. And so whether you have a monthly meeting, a quarterly meeting, maybe an annual convening or a summit, that's very, very important. And also a way to transfer the information and making sure that it's seamless and it's transparent. Also making sure that you understand each partner that is involved, whether it's a nonprofit, whether it's a public transit agency, whether it's a government agency or a private agency such as Ford Mobility or Blue Cross Blue Shield and things like that. But we want to make sure that you understand what their mission is and what their goal is, and then also maybe what their challenge may be while you all are working with each other. So that understanding is very, very important, right, as you all first come to the table. Also, a structure. You need some sort of structure, some sort of appropriate agreement that is in place that kind of has checks and balances and also divvies up the duties and the roles in those type of projects as you're kind of come together and collaborate to provide proper transportation that is needed in your area. Your mobility managers are the people that can facilitate these relationships. They are there, they are the eyes and the ears, and they can also be the liaison between those organizations. And so our first guest that's going to give us a great example of how they build partnerships is going to be Raven Alexander. She is with the city of Wichita. She is also the current president of ATI, which is the Association of Travel Instruction. Raven?
Thank you, Anjali. So as she said, my name is Raven Alexander, and I serve as the Mobility Relations and Grants Manager for our department here in Wichita, Kansas. So as she mentioned, I am the president of Association of Travel Training, or Travel Instruction, I'm sorry, but also I am the Mobility Manager for the department, and I stated the Grants Manager, so I kind of oversee our 5310 program here, along with the grant, being the grant writer. I do a lot of mobility relations, so a lot of forward-facing activities with the community outreach and education. I do partnership development, and I also am the civil rights coordinator for the department. So I just do a few things around here. Next slide, please. Thank you. So just a little bit about our department. I do like to highlight that only because regardless of the partnerships and things that I may develop, none of this can be done without our staff. So here we have, in Wichita, we're nearly a population of 400,000. As mentioned, we are a department of the city of Wichita. So we are the largest transit provider in the state of Kansas. And I know a lot of times people think that's weird to say because you have Kansas City, but Kansas City is divided between Kansas and Missouri. So that makes us the largest here. We have 120 employees, which include drivers, mechanics, and admin staff. We have 11 battery electric buses, and then recently we had 8 battery electric vans for our paratransit that were delivered. So we're getting ready to put those out on the streets. And then our core services are fixed route, paratransit. We have a Q line, which is our downtown circulator. And then also we do multimodal. So we do parking here. We have bike ped. We also do scooters, bike shares, all of those fun things within our department. Next slide, please. So just a couple of tips that I do like to talk about that kind of assist me with being successful with some partnership development is knowing your community resources and understanding the gaps. So it's difficult to know who to speak with or what needs need to be met if you don't know what's going on within that community. And so a way of doing that is, of course, listening to the writers, whether that is through surveys. We have an active social media page. We just recently did a study which involved a lot of community engagement. Sometimes just having boots on the ground and just being out in the community, having those one-on-one types of conversations, then that way it's easier for me to understand what needs are needing to be met within that community. And then also attend local and regional meetings. So one good place to start is your community health assessments. And I know here we call it a CHIP because that's our community health improvement plan. And so also walking into different rooms, whether it may be a town hall meeting, whether it may be different major projects that are coming up. I know sometimes transportation may be an afterthought or it's the last thought that others may think about as businesses are coming in and being developed. As I know recently we had a shelter that opened up. And so just making sure you're in those meetings and you're having those conversations ahead of time so that you are not an afterthought. And it's a lot easier to build those partnerships and come up with a plan there. I look for ways to say yes because transportation is important for reducing these barriers, making sure everyone is getting where they need to be, they're getting to employment, education, getting to health appointments. And so I try to find ways to say yes. No one wants to say, no, you can't go to school. No, you can't make your doctor's appointment. So definitely do that. Pilot ridership programs. And being a grant writer, I understand the importance of data or being able to tell the story. So there are instances where we will pilot a program maybe for a year. We've done some for 6 months. We've also done them for maybe 2 years. This allows the agency or the entity to be able to gain data for to see if this ridership program or if this partnership will possibly be successful. And then they are able to pursue different grant opportunities or funding opportunities that, of course, we may not be able to apply for as transit agencies. But having that data ahead of time definitely makes for a strong case. And then we also offer travel training. So while, yes, we may have these ridership programs, it may not be beneficial if they don't know how to use your system. And so we definitely make sure that we market that program as well, just to make sure that everyone knows how to effectively use our system. Next slide, please. So just a couple of partnerships that we have with one of our local colleges is with Wichita State University. We also partner with our Wichita Public Schools, which is going to also serve our elementary, middle schools, high schools, and we do have some alternative schools that are a part of Wichita Public Schools there, where we offer discounted passes, but we also assist with supplemental routes and things like that for students to get to school as well. International Rescue Committee is a great one. We do offer passes for families that are individuals, I guess not necessarily families, that are relocating to Wichita. They are able to get out into the community, get to English classes, basically get to the stores, just anything that they may need to do. They are allowed 6 months, transportation not being a barrier, to become acclimated to the community. We have the Substance Abuse Center of Kansas and also the Recovery Hub Coalition, as we know that substance abuse and sometimes with that mental health, it creates a barrier for individuals, having that struggle, not being able to get to their appointments, which are basically essential for them. And so we do have some partnerships with them, our Child Start program, and then also many more. Next slide. So the one I would like to highlight today as one of our successful programs, which also gets some nationwide attention, is our Veterans Ride Free program. And so in 2020, the United Way Continuum of Care and the VA Homeless Veterans Department, they had identified transportation as a barrier for their clients. They weren't able to look for jobs. They weren't able to get to medical appointments. They weren't able to just get anywhere that they were needing to get to for their daily needs. And so the solution is that we began a pilot, which originally started for 1 year. However, we know in 2020, it was a big year for us all. COVID had kind of, the city was slowly beginning to open back up. So we felt like it wasn't really fair to have strong data just for that 2020. And so we extended that over into 2021 as well. And that'll, like I said, allow for that data to be collected. And the pilot was such a success that in July of 2021, or I'm sorry, July of 2022, the city council actually approved for us to launch an official ridership program with financial support from the United Way and the VA Medical Center. And so an MOU was signed. Both of these entities are contributing an amount to Wichita Transit to kind of offset some of the operating costs. Now, with this, of course, we're not going to be able to charge dollar for dollar, because then at that point, we could be creating barriers for the nonprofits. But we did settle on a number in which they do contribute that, to maintain the program there. So originally we had 4 IDs that we had selected, and we're very strategic in doing so. Once again, with the VA, what would be IDs that the veterans would have access to? And so we didn't want to just make it, hey, anyone that just says they're a veteran, they're just going to ride, because then at that point, the data gets skewed and anyone and everyone can just get on the bus at that time. And so if they did not have one of the 4 IDs, the VA staff was actually assisting the veteran with getting the appropriate ID so that they are able to communicate. But earlier this year, Wichita ended up creating a City of Wichita ID to assist with some of these, as we may have homeless individuals, we may have, of course, veterans, different things like that that do not have IDs. And so we try to remove that barrier so that they are at least able to begin to get some services that they may need in the community. And so we did end up adding that 5th ID there earlier this year. And so with all of that, once again, we offered travel training. And so a lot of the veterans actually kind of knew how to navigate the system, but there were definitely some instances when I did go out and assisted them, and they may have known how to get to the VA, they may have known how to get to the grocery store. But of course, it's not just getting to those resources. For quality of life, they may want to go visit family members or may want to go visit friends, because we know that's important for our mental health and things as well, especially during that time of COVID where we were all kind of bundled up in the house there. And so did go out and work with these individuals. And so once again, these veterans can ride any route. And so they were able to get to other locations outside of all of that. And so a way that this kind of is sustainable is, once again, this is supplemented by the VA and also by the United Way. And so each year, the United Way of the Planes and also the International Association of Machinists and Aerospace Workers, and our district lodge is number 70, they host a 2-week, a fundraiser basically, and it's called Flags of Freedom. And it's 2 weeks, and they display nearly 600 flags within the lot of this machinist union there. And it just honors all of our veterans during Memorial Day. And so that is one of the ways that they continue to raise funds, but not just for transportation, with housing, mental health care, and just some wraparound services that may be needed. And so with all of this being linked to CCAM, we were able to go in and remove the barrier, and they were able to get access to the essential services that they were needed, even employment, healthcare, community resources, just all of the above. And so it's very customer centered. And so we wanted to improve the rider experience. And so once again, we provided the travel training if needed, but then also, once again, we removed that barrier for them to be able to get to these locations. So for that partnership coordination, it was between transit, of course, and then other agencies that were serving some of the veterans. And we just had kind of that interagency collaboration. And once again, we came up with an MOU in order to have that structure in place. So as far as economic and community participation, so these free rides, once again, increased access. Once again, I can't stress that enough. It increased access for these veterans to be able to get in places that they normally would not have been able to do so. And so how we reduce, we're efficient with some of the resources that we have is because we, of course, already had our transit system in place. And so there wasn't much that we needed to do other than grant them that access to do so. But also by allowing the veterans to ride free on our fixed route system, that freed up the capacity for the VA's transportation department to focus maybe more on county or other areas in the city where our fixed route system may not be able to provide services and things there. And so just to kind of highlight the success of the program, I mean, I can sit and talk about where all of these veterans are able to go. I figured I would show a video that we shared earlier this year that would actually highlight, and you would hear directly from some of those participants' mouths.
Raymond, are you able to hear it?
Not hearing any sound.
Okay, just a second. Do you hear the sound now?
No.
Okay, we tested this.
I was in the Army for 4 years.
We're good.
78 through
Okay,
80.
I will.
My name is Frederick Allen Wagner. I was in the Army for 4 years. 78 through 82. I refueled aircraft. This here is a place for mental patients as well as the homeless veterans. I've been homeless for 10 years after I went through a bad divorce. So they're here to help everybody, really, but you got to help yourself first. Hey, the bus is neat. It's like it empowers you where you don't have the ability to do things when sometimes you got to take advantage of the things and do it yourself to make yourself do these things, First, I was kind of nervous, about getting lost or this or that. Then I just started doing different things, with it. So this tells me the times where I can get on, what time they'll be there. So that way I got to be out, set down in the hot sun. Going to the VA on a Q-Link's all right, because I know I can go places where I couldn't before because I don't have any money. You get on any bus and show your ID and you're good to go.
My name is Tina Heim. I was in the U.S. Army. My job was nuclear, biological, radiological, and chemical warfare specialist. Being able to ride the bus for free, it really has opened up a lot of things. I feel like I'm able to get better care at the VA just because it makes it so I'm not having to limit myself to certain amount of visits at the VA each month. Because now I can make more appointments, get better care, and, just being able to shop, do different activities, like get to American Legion, because I love to go there and hang out with other veterans. Being able to ride for free has opened a huge amount of things. It is a pleasure serving veterans because they're very grateful, very kind, respectful, just all around happy to be able to have a ride out to the VA.
My name is Kevin Hicks, served in the U.S. Army. This is Convision, and I drive a forklift here on parts picker. We get these orders and we just go around and pick the parts from proper bins and locations, set them up and get them checked out. I didn't know that the bus system, Wichita bus system, was actually free for veterans. When I realized how easy it was to get here and how convenient it actually pulls up in, I couldn't believe that. That was just, how many buses do you know that will actually pull up right into where you work at? Veterans program bus rider allows me to keep this job and come back and Baltimore. It's a cost that I don't have to worry about, consider, and it just makes me happy that I actually there to provide it for the veterans.
Yeah, we really like Kevin. He's a good addition, and I'm glad he could ride the bus for free, because if he couldn't, we'd have to put up with somebody else, and Kevin's a good worker.
So those are just a few testimonials. And then there's always one that really touches my heart. Is there was a gentleman who also has a wife and kids, and they were homeless and had no vehicle, and he was able to utilize the system to get to job interviews. And we are Air Capital, so we have several airplane manufacturing companies here. And so he was able to secure a job at Spirit, in which he was then in turn able to purchase a vehicle, and they had housing and everything else for his family, just by removing that barrier for him to be able to navigate through the city without having to worry about how to get to job interviews. You know, Ubers are expensive, taxis are expensive, all of the above. So I felt like that was another one of those strong success stories. So thank you for allowing me to share about our Veterans Ride Free program. And here is my contact information.
Thank you very much, Raven. And we will also drop the contact information in the chat as well. Our next presenter is Christy Winchester. She's a mobility manager from Central Rural Oklahoma.
Hi, thank you. I'm going to go ahead and introduce myself, and then I'm going to turn my camera off. I'm in rural Oklahoma, and bandwidth doesn't always play the game with us.
We
So
understand. That's why mine's off. I hope it's not glitching too much.
yes. So we're going to be talking about partnerships that remove barriers to access. Again, my name is Christy Winchester. I have a lengthy background in leadership and organizational development, and have brought that to this space as I entered nonprofit and public service. And it's just been really incredible to kind of enter this space and understand where we can bring those partnerships and those previous relationships. So I'm going to turn my camera off, and we'll go to the next slide. All right, partnerships thrive when we understand each other's values. Partnerships are built on trust, and trust is built on alignment, not agreement. So when I first came into this role, I did a moral inventory of knowing my role in every interaction. I did an inventory of everybody I've worked with, all the different organizations in my previous roles, just brainstormed all of those different organizations, relationships, and didn't understand how they might fit into what I was doing with mobility management. But I knew that there were relationships that I needed to continue to nurture for my own personal interests, and of course for those professional interests. But I also wanted to make sure that we were in alignment. It doesn't necessarily mean that I agree with every single person that I'm working with. I just want to make sure that our values align. And so once I had that inventory of what that looked like with those organizations and those partnerships, I looked at what's important to me in the role that I'm in. Integrity, collaboration, equity, respect, trust, accountability. Which of these organizations do I want to work with going forward for the populations in mobility management and transportation that we are serving? So we're going to go on to talking about Sooner Success. I had been volunteering with Sooner Success for a very long time. My granddaughter was born with brain abnormalities that have created drug-resistant epilepsy, and she will not have a driver's license. And so I wanted to start working with organizations that were going to serve my granddaughter. I didn't want her to go into these organizations without us going in first and understanding who was a part of this, making sure that they had good policies and procedures and safeties in place. And so I began volunteering with children with disabilities. These camps are really important for communities, for community building, for families who are experiencing this journey. And it was life-changing to me. But I was working in those spaces in Metro Oklahoma City and Tulsa, and I live in rural Oklahoma, and my granddaughter was coming to this, and we said, let's bring this to rural Oklahoma. Let's talk about how do we do this in rural Oklahoma, because these families are out here and these opportunities don't exist. So we started talking over a year ago and what that looked like as far as transportation. And I would get phone calls about can we refer someone to help turn their van into an accessible vehicle. And so they were kind of these really dream big conversations until we started having a conversation about this particular SIB shop on the next slide. So the SIB shop on the left, this was a camp that we did in April. This was an overnight camp. And again, parents bring their children. These are sibling dynamics where one child is being raised with a disability and then one or more siblings in the home. Oftentimes they become caregivers. They are put into these roles of guardians of their siblings and really just have a different upbringing than children that are not in those same dynamics. And so at this particular camp, there was a gentleman. He came from quite a ways, and his mother had to come and get him in the middle of the night, and she did have a vehicle situation. She was not able to get there, and it was sort of an emergency situation. We needed mom there to assist. She'd never been away from her son, even for a babysitting situation, and it was just really this frantic moment of how does she get to her son? And it opened up my eyes that you don't even realize that you're on a mobility journey until you're in it, until you are standing in the middle of it going, how do I get to my kid who is in an emergency situation? And so when we designed the SIB shop flyer on the right for Okemah, again, the camp that we did on the left, that was in Norman, Oklahoma, which is a large metro area. But then we started talking about how do we do this in rural Oklahoma? And we talked to the city manager of Okemah, who was on board from the get-go. She was so excited, bring this to our town. We are ready to do this. And so through those partnerships and conversations, we realized rural Oklahoma transportation is a barrier to access for almost any engagement. And so we spoke to public transportation in the area. We asked them, it was an email conversation, which actually ended up, I'll get to that in a second, but we started this email conversation of how do we provide transportation? How do we remove that barrier? And through the partnership with Sooner Success, Mobility Management, COED, the agency where I work, CATS, and the city of Okemah, we have come up with a plan to make sure that no one has transportation as a barrier to this event in October. And so through this, all happening through email, this flyer was created by Sooner Care, and it started circulating right away before I had a chance to look it over because everyone was so excited about this opportunity. And when I finally looked at it a day after it was circulating, it had the director of the transportation company. It had her email, her direct cell phone number. And I could not type fast enough. Please, please, please fix this, put my name on there. Again, for tracking purposes, we want to make sure that we're doing this in a way that serves everyone. But we also don't want to alienate our transportation director by inundating her with emails that she really didn't ask for. So working together, we made sure that all the contacts are appropriate. It's going to come to the right person. And we are tracking that. And here's what's happened. This is the beauty of the partnership. Okemah is about, I would guess, probably 50 miles outside of Oklahoma City. And then there's a town even further, about 60 or 70 miles outside of Okemah. And we received a call asking if we could provide transportation from that town to Okemah for this opportunity. And while we really want to reserve that resource for those living in and around Okemah, because those are the partnerships that have agreed to help fund this, what it's done is it's really identified we have a need to move this SIB shop to a different location in Oklahoma because families are looking for these opportunities. And we know that transportation is going to be a barrier because they're already reaching out going, I want transportation to this event that's really far away from my home. And then yesterday, speaking with the special education departments at the schools around this location, because again, when you drop your child off with anyone, there's that comfort level. You have to understand that, that they're going to be in a safe environment. And it's the exact reason I started doing SIB shops. And so we want to talk to the folks who are dealing with these families and these dynamics and help them understand this is safe and it is new. So it is a leap of faith asking these families to take this on. And so we're explaining to the special education departments yesterday, and the first question was, will there be transportation? And so they understand that that is going to be a barrier in their community. And yes, we're going to provide transportation. So going forward, these SIB shops have been going on with Sooner Success for several years, long before mobility management got involved, long before I started volunteering with them. And going forward, we have implemented transportation as a key component to this event, regardless of where they're being put, regardless of what town they're going to be in. We're going to work with those public transportation providers to make sure that that is no longer a barrier to these families being able to access these opportunities. Next slide. All of this, again, I think it just wraps up. I've taught leadership development for so long that I really wanted to leave everyone with the bridge builder, because I think it is so important to who we all are and what we're doing in this role. So bear with me. An old man going a lone highway came at the evening cold and gray to a chasm vast and deep and wide, through which was flowing a sullen tide. The old man crossed in the twilight dim. The sullen stream had no fear for him, but he turned when safe on the other side and built a bridge to span the tide. Old man, said a fellow pilgrim near, you're wasting your strength with building here. Your journey will end with the ending day. You never again will pass this way. You've crossed the chasm deep and wide. Why build this bridge at eventide? The builder lifted his old gray head. Good friend, in the path I have come, he said, there followed after me today a youth whose feet must pass this way. This chasm that has been as naught to me, to that fair-haired youth may a pitfall be. He too must cross in the twilight dim. Good friend, I am building this bridge for him. And I share that with you today to encourage you to always be the bridge builder in your relationships, understand who you are in every interaction, clarify your expectations and responsibilities to build that trust and accountability, but know who you are. Understand that you are also a part of that puzzle, and just know what your role is. Self-awareness is a leadership skill, and it's so, so important in every interaction that you go into. Do that inventory with all of the organizations that you work with. Make sure that those visions align, that your values align, and that the projects that you're working on align with who we are as mobility managers and also who you are as a person. So thank you guys for allowing me to talk to you today. I think that my contact information is somewhere in there. And if you have any questions, I'll be here.
Thank you so much, Christy. So the next thing that we want to have a short discussion about, but we want to talk about taking action and what the next steps are for you all in your communities, locally, also statewide and regionally. And first, you want to assess what your partnerships are using the CCAM partnership evaluation tools, identifying those strengths and opportunities for growth. Also, accessing the CCAM resources. You can simply just type in Google or type in your search bar transit.dot.gov/CCAM. They have a whole inventory where you can see what type of partnerships have been made. And although they are on a higher level, you can scale those down into a local level. And also, you want to develop those professional skills. Look at joining a mobility management training program. National RTAP has rolled out a whole list of mobility management training series, and they are now planned out through 2026. So those shall be posted within the next week or so. Also, the Association of Mobility Managers has several webinars that have been hosted, and those have been planned out through 2026. ATI, which Raven is the president of, also has mobility management training programs and travel training and all sorts of webinars that are also coming out as well. And so it's very, very important working with and collaborating with peers and learning what type of resources they have and what type of partnerships they have developed as well. And then you can start small by launching small pilot projects. Some of it may require large grant funding, some of it may not. Some of it just maybe pulling funding together. Or just maybe just simply partnering. There may not be any funds that are required because you all are simply doing the same thing. And we will check around in the chat here to look for questions. And I see a few pop-ups here. Okay, this is for Raven and for Christy. Some of our questions are coming directly to us here. Let me scroll for just a little bit. Can either one of you list any challenges that you face while coordinating with the partners of examples that you have given us today?
I can go first. I wouldn't necessarily say with the agencies or entities that I've listed that we do have partnerships with, but we do experience those that just want us to just give them everything for free. They're not willing to, I don't want to say negotiate. It's just, hey, I have this need, just do it. So that's kind of an issue that we may come across, but then also kind of the perception of transportation when trying to engage with other major businesses like hospitals or things like that. A lot of times they are shutting the door a little faster because of the stigma of transit. They like to think that it's just for poor people. And that's not it. And so sometimes I have to work a little harder to adjust that community perception by maybe business owners or things like that in order to really be able to sit down and have a meaningful conversation. So sometimes having to just remove the stigma.
I think that I'm going to go with Raven on that. Definitely not with the partnerships that we have been able to cultivate through the specific one that I spoke about today with Sooner Success in the city of Okemah. But in working in 8 counties, they're so different. And some of those counties have been very resistant to understand what mobility management is and how we can support them. And so I think that has been such a challenge as far as getting in the door and explaining. And also, I mean, we're sparkly people. They want to work with us. They just don't know it yet. And so getting in the door has been a challenge. Having a meeting yesterday in a community that I work in, it was pretty well represented by a lot of organizations. And then one person's looking around the room going, hey, are there any city representatives here? And it was glaringly obvious who wasn't in the room. So I think that's been a challenge for me.
Okay, the next question. What type of grant funding was used for each of these projects? Was it complete? Let me see if I'm reading this right. They're asking, was it all public funding? Was it private partnerships, city taxes, or also state funding, or a combination of all?
Ours was for the transportation for the Sooner Success for the Civ shops. That has been grant funded by Sooner Success. They had that in their grant for this particular programming. It was discretionary funding that they normally do for like gift card, gas cards and such.
So for majority of our programming, it may have been privately funded by that particular agency. However, there are other federal funds. I know, like through the school district, they're able to use like some of their transportation funds and that they're able to use towards that. No, not directly city dollars were contributed. Most of these entities kind of did that on their own. But there are times where, and I know even with International Rescue Committee specifically, we had tried to partner on a grant application. And so with me being a city department, I couldn't directly apply for the grant funds. However, the International Rescue Committee was able to apply for those funds. And we also did that in collaboration with Wichita State. And so there were three of us basically that went out for those funds. So we get kind of creative. So there are things that I may write a grant for, and I may be able to incorporate some things. There may be things like AARP, there may be local foundations. Everyone kind of just gets a little creative as to where the funding may come from.
Great, thank you. That's a great point, Raven, to make sure that you all align all of your priorities and then you partner so everyone is not competing for the same grant. Or a lot of times it's better to collaborate and write for a larger amount than dividing it all up. And then there are the chances that maybe no one will get the grant. So versus if everyone put all their heads together. The next question we have, what are the steps that you should take in forming a mobility management network or division?
So I guess as far as maybe a network, once again, being in meetings, having conversations with anyone and everyone really, because we're all there to assist our community, we're all there to assist clients. It may just be in a different capacity, but we're all there to benefit them. Definitely enjoy passing my card around. But once again, having those face-to-face conversations, maybe sending out emails of different community events that you may be attending or that you may be hosting, definitely in resource fairs. I do know here in Kansas, we do have a mobility management network, but that is sponsored through our state. And so I really wasn't a part of that development just because, once again, I'm a local entity. And so I'm not under that umbrella. But my personality, I'm just out there everywhere in everyone's business and all the meetings I can be at, once again, to engage, to know what the community needs so that I can come back and see what types of programs, or even if it's realigning routes, how do I better the community for these individuals?
Christy?
I don't know that I would really say much different. Again, not having that exposure to transportation necessarily previous to this role, I knew the importance of coalitions in small communities. And so I went and I found every coalition that I could join. And what I understood was there were a lot of people that had transportation as an agenda item in their meetings. And I was chasing my tail trying to catch every meeting that had transportation as an agenda item. And that was how we've slowly started shifting those to having those regional transportation meetings So we shift it from their agenda to where we are now, we have our own agenda and everybody's coming to those partnerships and tables. And so we can really dig into the collaboration and those coordinated plans in Oklahoma, and get to the nitty gritty of what we need to be doing. So again, just being in the community and attending those meetings organically, you will start to build that network.
So I had a question. They wanted to know how exactly do your programs relate to the overall CCAM agencies? And I do apologize, as I stated, there was something going on with our slide deck. However, I do want to highlight those CCAM member agencies that relate directly to Christy and Raven's programs. The first one is Department of Veteran Affairs. The second is the National Council on Disability. The third one would be DHHS. The other is Department of Education, Department of Justice, and then of course, one of the largest is Department of Transportation. And so when you go and you look up CCAM, you will see those listed on the FTA website, and then there will be some relevant sub-agencies that will be able to guide you and then let you know how things filter down examples to your local level. I believe I've answered that question. On to the next question. Okay, the next question is about piloting. What is your best practices in piloting programs and what type of grant support? Are they from TA centers, Health Foundation grants, or FTA discretionary grants? And I believe what they're trying to say in this last part is, or grassroots organizations that may fund some of these programs.
I'll speak first on that. Like ours was definitely more grassroots because the city really wanted that, and definitely going to those coalition members to do a lot of the efforts to pull together the event. But as far as it pertains to the transportation side, that funding did come from Sooner Success, which is funded through a division of the community living grant funding.
And so I will say ours is more so kind of grassroots or local levels, maybe some foundations. As far as like discretionary grants, I think with us being large urban, it's a little, I don't want to say difficult, but it's a little difficult for us to sometimes go into for those because that more so benefits more of the rural. But then it depends on what type of project is actually being piloted. And so you do want to read through those and make sure that those are actually aligning. There are times that we may even just offer it for free. Like I may say for a period of time, hey, for a year, we're going to let these individuals that have this proper ID, all of the above, ride for free, no cost to that agency. Once again, because they're going to need the data in order to apply for the grants. And so we'll do that for that period of time. We'll go back to the drawing board and say, hey, this is how many rides we're taking. This is what it would have cost, with them paying, all of the above. And somewhere we kind of meet in the middle with a number. I know with Child Start, for example, there was a particular grant that they were going to apply for. But once again, they needed that data. And so we allowed them to pilot that for 9 months. They had their data. They went and applied for their grant funding. They got that grant funding, and then we just kind of developed that agreement from there. I hope that answers the question.
That leads into the next question. Let me scroll and find it here. I just lost it here. So the next question is, how do you offset the cost of the free rides in your area? Are there other partnerships that subsidize?
So once again, for like the Veterans Ride Free, that is subsidized by United Way and for the VA. And for that, once again, we started out with the free. We then settled on an agreement, an amount with United Way and the VA. But then as the program began to grow, of course, their what they subsidize is a much greater amount than what it initially started with, of course, because we're looking at how the ridership has expanded. It can just vary by the program. I know USD 259, they subsidize their, Wichita Public Schools, how I listed it. They subsidize those routes. I know our university, they subsidize the routes subsidize the free rides for their students as well.
Christy, did you want to answer that? If not, that's okay. I have another question here.
No, I don't really have anything to add to that.
Do either of you also work with your public transit agencies to partner and develop MOUs or help fund? I believe they're kind of talking about through a purchase of service with any ride share to reach the first and last mile connections.
We haven't done that in our area, no.
So I am the transit provider here in the area. However, we do have a county service, but then also we have some 5310 providers as well. And so we do not do third-party contracting. We found that to be a little difficult once upon a time with making sure that everything was in compliance, but also take into consideration, I'm not an authority. I am a city department. And so sometimes I have to jump through a few more hoops than what an authority may be able to go through and have done. However, our Sedgwick County, they actually do some third-party contracting. And so they do have their procurement process, and it may not necessarily be first mile, last mile. They may be actually going out into the county. Some things that we may do for our first mile, last mile is that we have bike shares that may be located at the end of a particular route or at a particular location in which we know that individuals are trying to get to this industrial park. And while I may go south and I can get them close, they may take that scooter, they may take that bike share, that bike, and they may get to where it is that they need to be.
Okay, great. For both of you, how do you measure the success of your programming? Do you survey the veterans? Do you survey the families? Do you have some sort of way of where they may survey the children in the program, for example, for SIP shops?
Yes, they do have. So SIP Shops is sponsored by the University of Oklahoma. Sooner Success is housed at the University of Oklahoma, and they do an extensive survey and they share those results. So we will have access to all of the results from those surveys following the event.
So each program is kind of different. Of course, we'll do some surveys. However, we obviously look at ridership data. When you're looking at like the Substance Abuse Center of Kansas, they actually have their clients come in every month before they're provided another pass. And they're able to ask, hey, did you make it to all of your appointments? How many meetings did you go to? They have a list of questions that they're able to kind of see and determine, hey, this person is really actually utilizing, or no, they're really not benefiting from this, and there may be something else that is going on. And so ridership, of course, is our main one, but yes, there's definitely surveys. And then of course we get agencies out there that do a lot of they give us testimonials. So we have flash drives of testimonials when they get out there and actually engage with their clients.
That's a good point, Raven. They also, yes, they do. Sooner Success does testimonials with the families also. And because they will be using funding to pay for the transportation in this particular event, there will be specific questions on that survey regarding the transportation aspect that they will be able to filter back to us as well. So they're gonna blend that in because money will be used for that purpose.
Thank you, ladies, very much for your presentations today. And I think that everyone's learned quite a bit of information on how they can develop partnerships through local organizations and agencies. If there are any questions, please feel free to contact us at National RTAP at info@nationalrtap.org. We would appreciate if you provide us with feedback about today's webinar. If you have any questions, and I've dropped the link, you also have the link emailed to you right after this webinar. Everyone enjoy their day. Thank you.
Thank you so much. Have a great day.